Hello everyone, my name is Lori Bombacco. I'm a registered dietitian and I am also board certified as a specialist in oncology nutrition. And just so you're aware, only 1% of all practicing dietitians are board certified as specialists in oncology like I am. Now, what I've been asked to do is to present to you all a 6-week series about some of the common questions or problems that someone with kidney cancer may encounter and may want to ask an oncology dietitian like me. We are halfway. So we are in week number 3, and today I want to do what I've done in the past 2 weeks. I want to present this common question and then also provide you with some simple yet effective solutions so that you are best able to nourish your body despite any challenges that you might have. Now, I do want to give a disclaimer. Sometimes individuals get advice from all places, all sources, and any advice that I might give to you today is really just generalized, and it's not meant to replace any medical advice that you deserve from your medical team. So if you have any significant concerns or any questions about your nutrition, please discuss this with your healthcare team and don't replace my advice with what they may suggest for you. Now, why nutrition? Why do I know and believe that nutrition is so vital for anyone who is diagnosed with a cancer? Well, what we know is that there are some foods that we consume that have cancer protective qualities. And this becomes even more vital for someone who is on treatment, because treatment may create some shifts to how someone can eat. And that may challenge their ability to adequately nourish themselves. So consulting with an oncology dietitian like me can help you best understand what specific recommendations are advised for you, because you deserve a special nutrition care plan that's just as special as you are. Now today, what I'd like to talk about is one of the common questions that I do get asked for individuals who are diagnosed with kidney cancer. They ask me, what do I eat if I am struggling with nausea? What a great question that is, because nausea, as it turns out, can be a consequence of many different causes. What we do understand is that the diagnosis itself can cause, the cancer itself can cause nausea. The treatments that are used can cause nausea, including chemotherapy, immunotherapy, radiation, as well as surgery, or a combination of all of those things. This can cause nausea. And also certain medications can cause nausea. So for example, pain medications, they're notorious for causing nausea. And really the ultimate remedy for addressing nausea or treating nausea is to combine an integrated approach, one that includes the medical intervention as well as some nourishing foods so that you can help manage the nausea while fueling your body with the nutrition that it requires. So sometimes we may suggest prescription medications to help address nausea. Sometimes we may advise relaxation techniques, so things like acupressure or deep breathing or meditation. This is great for nausea if it's related to stress or anxiety or even fatigue. We may also recommend a review of medications. So if you are on pain medication, we may ask that you take that pain medication with a little bit of food, because that will help your tummy better handle that pain medication. Now, some patients do have anti-nausea medicine that creates some constipation. And if you look at the YouTube channel, go back to last week, week number 2, where I suggested some solutions for how to address constipation. There's some good tips in there. But today, we're going to focus on nourishing solutions if someone has nausea. So the first thing I want to point out is to consume small, frequent meals. And really what that means is maybe eating 6 up to 8 meals per day and having a little something every 2 or 3 hours. I like to refer to that as not letting the tank go empty. Because the tank, our stomach, is literally that. It's this big holding tank. And anytime it's empty, that's when nausea can present itself. Now, this could be a challenge for someone who is used to eating 1 or 2 very large meals a day. And so if that applies to you, think about making some gradual small changes, and think about maybe keeping that routine of 1 or 2 meals per day, but just adding in a couple other meals or mini meals or even snacks so that you help to satisfy that tank and not let that tank go empty. Another helpful tip is to minimize odors. So that's my second tip for now. Minimize odors. And I'm not suggesting only perfumes or room deodorizers. They can exacerbate nausea, right? But also food odors can exacerbate nausea. So we may want to choose cool or even room temperature foods because they don't have an odor, and that will not trigger nausea. I'm going to highlight some choices in just a moment for you to consider. You may also want to think about where you dine. So if you can dine in a place that is well ventilated or away from the kitchen. So this is where caregivers become especially important. If a caregiver can prepare meals and then bring it to the individual away from the kitchen, that may help control the environment so that they don't feel as nauseous. The last tip that I want to point out is very similar. We want to create a peaceful environment as it relates to nausea. So sometimes stress can bring on nausea, right? Sometimes a little bit of worry or anxiety can create nausea. We want to create rather the opposite, a relaxed and peaceful atmosphere. So sometimes taking deep breaths or even playing some relaxing music or lighting some candles, having the lights dimly lit, this can create an atmosphere that's more conducive to relaxation and calmness. And gosh, that's so effective for helping us to digest our food better. It's a good tip, I think, for everyone. So what about food choices? We want to talk specifically, right? As a dietitian, that's what I'm good for. We want to talk specifically about some food choices that are preferred in order to help you tolerate foods best, but also receive the adequate nutrition that your body so desperately requires. So let's start first with what I would suggest are dry choices. So dry foods are best handled in a tummy that doesn't feel well. So good examples of dry choices you may already know, but I have some here to show you. So pretzels, great example of a dry, bland choice that will be well handled for a nauseous stomach. So sometimes patients will keep this at the bedside. If they wake up first thing in the morning, they'll have some saltines or pretzels, and they put a little something in their tummy to get the day started. Or if you're someone who is in bed all day because of fatigue or you're just not functional, you may want to keep something like that at your side so that you can have a little something to nosh on every so often to keep that tank full. Other choices for dry foods are also dry cereal. So one of my favorite cereals are rice-based cereals, so puffed rice or rice Chex, for example, and to nibble on them dry. And they're super great for portability, so you can bring them wherever you are. They don't require much effort, and they're easy to stock in your pantry. The next step I would take is to consume foods that are bland. So bland foods include things like boiled potatoes. So I have some potatoes here, and you would just peel these and boil them, and they will be great for an empty, nauseous stomach. Other choices are rice, good old rice, and then noodles or pasta, and just plainly cooked, right? So you can cook these in water with a little bit of salt, or you could add some broth, whether it be vegetable broth, a chicken broth, or a bone broth. This will infuse some extra nutrition as long as your tummy can handle it. Other choices for bland foods include good old applesauce, some bananas, which I don't have here, but bananas would be a great choice too to keep that belly comfortable. You could also cook some vegetables like cooked carrots. As long as they're plainly cooked, these would be easy for the stomach to handle and give you precious nutrients that your body needs. And then lastly, I would think about things like tea. I have a recipe for tea coming up. And then also even to sip on some warm broth. So to warm this up again in the microwave or on the stovetop and to sip on this, this will serve a couple purposes. It'll keep you hydrated, give you precious nutrition, but then also help quiet that nausea. Now, I do want you to focus on, besides these bland and dry foods, some protein choices. So protein choices as well should be bland. So think about some bland, plain baked chicken or turkey, as well as plain cooked oats, which gives some protein. Yeah, I went there, I said it. Some low-fat yogurt, if you feel up to having that. And then also some tofu or some eggs that are well cooked. Again, you decide what works best for you and your tummy. Now, what I want to share with you too today is a recipe, and it's a great remedy for nausea. So what I have here on the stovetop is 3 cups of water, and it's simmering a very precious ingredient, and that's ginger. So ginger root you'll find in any grocery store, and it's easy to use, right? So you could break off pieces of this ginger. I have a lot of it because I'm going to use more later. But you can break off pieces of this ginger, and what I want you to do is to wash that ginger root, peel 2 inches of the ginger root. So that's probably about this much here. And you're going to peel that and then slice it very thin, and you're going to add that to your 3 cups of boiling water. And you're going to let that simmer for about 15 to 20 minutes, and that's about what I have here, and it smells delicious in here. Now ginger, let's take a moment to talk about ginger. Ginger is basically medieval, okay? It dates back to the 11th century. Did you know that? And ginger has been it's been used as a folk remedy to quiet an upset stomach. That's what nausea is, right? But besides that therapeutic remedy, ginger also contains these really important precious phytochemicals that are cancer fighters. So things like gingerol, and what gingerol and other phytochemicals in ginger do are they help to reduce inflammation. So really a great ingredient to use across the board regardless of what your concerns are. Now ginger has been used in research compared to anti-nausea medicines and has been shown to be effective in reducing nausea. So whether it be the ginger root that you decide you want to use, or incorporating the spice, again, another easy thing to keep in your pantry, or another great product are frozen cubes of ginger. So in this product, literally there are 16 cubes of frozen ginger, and 1 cube equals 1 teaspoon of ginger. So if you're looking to incorporate more, whether it be a soup or a stew or a stir fry, think about incorporating a product like this for convenience and also the nutrition and the remedy for nausea. So what I'm going to do is I'm going to take off my my lid here, as this has been simmering for quite a while. And again, it smells delicious. And what we're going to do, I don't have the best pot here, but we would strain off the ginger. We're not going to consume the ginger. We're going to consume the liquid that the ginger was cooking in. So we could use a strainer like this one, and we can pour it into a pitcher, or we can use something like a slotted spoon like this one, and we're going to take our ginger out. So our ginger's been in here again for 15 to 20 minutes, and we're going to take out that ginger. It's got that great pungent flavor I happen to love. If you're not a fan of it, you may want to dilute this recipe further. But we know that this has the therapeutic benefit of helping to quiet nausea. And I'm going to use a measuring cup to take out some of the liquid to show you what's left. Now to this ginger tea, we can add additional flavor if we want. It's based on your preference. What's really neat is that it shows some of that color from the ginger. So if you see, it's like this really light yellow, really pretty color. Great smell, great flavor. And then to this, if we wanted to, we can sweeten it. So if we can add some honey, a little drizzle of honey would be great in this, or some lemon, depending on what you prefer. So I'm going to put a little bit of lemon in there, and voila, you have a nourishing recipe to help address some nausea or to help boost some cancer-fighting properties in your overall diet. Thank you for watching. Stay tuned next week. We're in our 4th week, and I'm going to address another common question that individuals ask me and provide some solutions so that you can nourish your body with the ultimate cancer protection. Cheers. It's delicious.